Good morning, everybody. Good morning or good night, good evening, good day, wherever you are on the world. It's very good to have you here and to see you here. Welcome to the Europe region's part or involvement in the EPA Web Marathon on sustainability and sustainable goals. So we are, as you can see, we are with the World Physiotherapy Europe region, and I'm sort of been hopping in here. I'm not the chair. I'm not Esther Mary Darcy, who's the chair of the region. As you can tell, I'm not her. But there have been some issues, so I'm just hopping in to do the introductory part. My name is Stefan Hegenscheidt, and with me is Fran, Theron, and there's also Miguel, who's from the office of the Europe region of World Physiotherapy, who's doing a fantastic support job for us here. And we are very happy to contribute to this Fat Marathon with this very important topic. So the Europe region is one of the World Physiotherapy regions, and as the region, it has different working groups and subgroups, and these cover different topics that the region considers important for the profession. And obviously, sustainability is a very important topic. And so there are different working groups in the region. And one of them is the so-called professional practice working group. There are additional ones like education working group, and also there's an advocacy working group. But this one we're from the professional practice working group. Esther Mary Darcy, who is not here at the moment, unfortunately, she might join later, is the chair of this working group and also the chair of the region. And then there's me, Marcel, and Fran, who are members. We're not the only members. The working group is much larger, but we are the subgroup who deals with issues of sustainability, SDGs, all these things around environmental aspects. And if you could go to the next slide, Miguel, then we are very, very happy to contribute to this event. So we've been in touch with the EPA, the Environmental Physiotherapy Association, who is also a partner of World Physiotherapy. And as you might know, this event has been going on for 2 days already. It's a web marathon with different countries offering different sessions and offering different inputs and opportunities to chat about things and to discuss things. And we're very happy to contribute to that and to take the opportunity to show to you, to demonstrate some of the work we've been doing over the last years, and also share some ideas, what we are planning to do. And obviously, we would very much like to get in touch with you and engage a discussion where we can hear about your ideas on sustainability in the context of physiotherapy. From the structure, this is what it goes about. So the working groups of the World Physiotherapy Europe region, they are subject to discussion and approval of the members of the region, which are the Europe nations physiotherapy associations, really. So from the General Assembly, there are inputs from the members who suggest certain topics to be followed by the working groups, and which are then approved, and the work from the working groups needs to be approved. So in 2020, there was a strong drive towards work in sustainability and sustainable development goals within the profession, and this has been going on for a 2-year period, which is always the period of a working group. And then there's work being done, and there are recommendations from the working group and from the General Assembly, and this is carried over to the period of 22 to 24, and from then it carried over to this period, which we are now in. So Fran, Marcel, and myself, we are the subgroup on sustainable healthcare and sustainable development goals. And we would, as I said before, we would like to share some of the information and some of the work we've done to hear about your ideas as well. So our job, as designated by the General Assembly, was to explore the professional implications of sustainable healthcare. Now, we are very well aware that this is not the only area where environmental aspects relate to physiotherapy. As we've said before, there are education working groups, there are advocacy working groups, so there are different areas. But this one is about the professional implications of sustainable healthcare. And so we were assigned the task to develop actions in this area, and also to collaborate with the education working group and also with the advocacy and EU matters working group to see how we can progress this topic. Thank you, Miguel. So what we did for the first bit was we thought about how can we support sustainability in physiotherapy practice, in professional practice, and then we thought about the individual physiotherapists as well as physiotherapy clinics throughout Europe, and also obviously also we thought about the different nations' physiotherapy professional associations. And we decided to develop some slides and graphics providing information, because what we found when we did our research and how we interpret the existing evidence on this, physiotherapy has a very strong position in terms of sustainability. So there are many aspects like reducing waste, reducing unnecessary surgeries, stays in hospital, and all these aspects where we can demonstrate that physiotherapy, as I said, has a very strong position in these things. But many physiotherapists are probably not very aware of this strong position. So one of our intentions is to provide material and information to the national associations for their members to actually support individual physiotherapists to go out there and say, yes, we're strong on this. This is the right profession. Give us more capacity, give us more responsibility to do that. We can contribute towards a sustainable healthcare system. And we developed a set of slides which have completely different topics. There are slides on prevention, on cardiovascular prehab, and all these things. And we're going to send these out to for free use, really, for the national associations and their members. And these are all around the five existing principles of sustainable healthcare. So we are checking the principles, see how does that relate to physiotherapy. We're providing slides, infographics in different formats. So we're going to have PowerPoint slides, we're going to have PDFs, we're going to have these little things for all the social media marketing, which can be used. And then we're going to throw that out into the public for free use to show physiotherapists and for them to use it to demonstrate how the profession is actually within their current work and current activities is able to make a huge contribution to sustainable healthcare. And also to empower colleagues and to facilitate their understanding of their role in sustainable healthcare. So if one physiotherapist introduces a new prevention course in his physiotherapy clinic, that's one little step towards sustainable healthcare. But they might not be aware that they can actually do it, and that it is at that level that they can make a contribution. And then, so there are these five principles that we are relating this to. We are well aware that this is not the only things we should and could think about, and we come to that later. But this is the kind of material we have been developing over the last year. And then we also have the topic of AI, which we employed and used during our work in the working group until we realized that actually this is an issue of sustainability as well. So AI is obviously out there, and many colleagues use it, and it's not going to go away. But there are issues on sustainability and environmental impact of AI farms and server farms and things like that. So we decided that we will have a green AI information and guidance document from the Europe region, which we're going to put out there. And this is on how to make better use, and by better in this context, I mean more sustainable use of AI. Because, as I said, we figure it's not going to go away. So people are not going to stop using it. And there's a huge potential in AI as well to contribute to waste management, better waste management, resource management, optimization, energy efficiency. So it has all these positive aspects as well, which are related to sustainability. But obviously, there's the problematic side as well of energy consumption of the server farms, of water consumption, all these things. So there's some very basic approaches that can support minimizing the environmental impact of AI use when you're actually using it. So what can I do? How can I use AI to make it more green, if that's possible at all? So that's what this guidance document is about, or will be about, what we kind of put out there. And then we have two other major aspects, which my colleague Fran is going to explore a bit more. Fran, if you're okay.
Perfect. Thank you very much, Stefan. So Stefan has focused on the work that the subgroup of the professional practice working group has been developing. So these were kind of the slides, and really focusing on the opportunity that physiotherapists have on sustainable healthcare, and the opportunity we have on reducing the overall healthcare emission and carbon footprint. So those pieces of work were done with the subgroup of the professional practice working group. But there've been pieces of work where we've collaborated with the other members of the other working groups. So Stefan mentioned them earlier. So we've done work with the Education and Research Working Group and the Advocacy and EU Matters Working Group. So one of the recommendations that we had was to look at the promotion and the inclusion of sustainable development in the entry to practice programs. So it was all around, how do we promote the education of sustainability within the entry to practice programs? And when we met with the Education Research Working Group and the Advocacy and EU Working Group, we realized that we didn't actually have a baseline data. We didn't know within the the numerous programs that are held around Europe, is sustainability, is it taught in the curriculums? Isn't it? Some programs might have been able to introduce it a lot easier than others. Others may be facing a lot of barriers. So we decided that what we need to do was get some baseline data. So we've developed a survey which has gone to all the programs that are providing entry to practice physiotherapy programs across Europe. And we're really just exploring from those programs, have they been able to introduce the education of sustainable healthcare into their programs, and what's facilitated them being able to introduce it? And then for those programs that haven't been able to introduce it, what are some of the barriers? And we're hoping that once we get that data back, we can then look and see, okay, well, these are the enablers, and this facilitates them being able to introduce it. These are the barriers. And then we can look and see, okay, so what can we do now? And how can the Europe region and the working groups actually facilitate this? Because it's such an important area, and sustainability and sustainable healthcare and the impact of physiotherapists on climate change, and also the impact on physiotherapists of climate change, really needs to be a big focus. So once we get the results of that survey, we will write it up into a report, which will become available for organizations to look at. But then the recommendations for the next working groups will be to take that on board and see what they can do, and explore that further. And then we've been working with the Advocacy and EU Matters Working Group as well. So they'll be helping and very much linking in with Miguel, who's part of the Secretariat of the Europe region. And they'll be developing the resources, or the resources that we've developed. They'll be, adapting them for social media, adapting them for much wider use. And that will really help us kind of advocate for the significant role that physiotherapists can play in reducing our carbon footprint.
Yeah, so if you have any questions or comments or ideas, just please, we're a small group, please go ahead. We're very keen on hearing your visions and ideas.
Hi, Fran, I was just wondering, what were your findings when you were looking at the education programs throughout Europe? Like, is that still in progress, or is it like a scoping review, or what form is that taking?
So it is still in progress. So a survey was sent out to all the program providers, and we're just waiting for to get, Miguel would probably have an update on where we are with that, but we were still actually waiting to get the data in. The last time we looked at it, there wasn't really enough for us to start looking at. So we will hopefully have some more data in the next few weeks, and then we can start writing it up. But it was really just an online survey where we were looking at what had been included within the programs, what were the enablers, and if the universities hadn't been able to kind of introduce, we kept it quite broad in terms of they had an opportunity to provide information on what had been included, because it's such a huge kind of topic, and you could go down the avenue of looking at the impact of climate change on our patients and how that's influencing and what we need to be teaching within the curriculum, as well as the raising the education and awareness of the role that physiotherapists play. So we kept it quite open so that they could kind of put in information on, have they included this within their programs, and if they have, what's their interpretation of it and what has actually been included. But we haven't started writing it up as yet. So hopefully we'll get that data in kind of by mid-December, and then we'll have a report ready by the general meeting, which is in May of next year.
Thanks.
And if I can add on that, I think what's also interesting is to see the differences, because there are different approaches to integrate this into the curriculum. You can say, yeah, we have one module on sustainability, which is good, obviously, but there's also the aspect of doesn't it have to go into like almost every module that we teach? Doesn't it have to have a place in every module to come up again and again and again, because it's so important in different aspects as well of the physiotherapy practice and the patient side. So we are very keen to see what comes out of that research, because that would be something that we would be very interested to hear from your side, if you have anything that you may contribute, because with what we've presented so far, with the different slides and all the things, then we think this is a good thing and a valuable thing to do. But it's also within the scope of business as usual, what we call it. So it's about what we do at the moment. How can we make that more sustainable and contribute more? But there's also the other things, things that we might not even think about, roles that physiotherapists can have, or maybe do have already, that are not very well known. That could be a role in the government, or in urban planning, or in I don't know, in schools, things that may not be within the scope of the profession currently, of the main profession. But we are very interested to see those, because probably business as usual and just improving sustainability of that will probably not be enough to really make a change of our healthcare systems throughout Europe. So what do we need to do? What can we do? What ideas are out there to transform the role of physiotherapy towards sustainable healthcare? Maybe you have anybody in mind, or you yourself have any role that is sort of special and out of the usual. We would very much like to hear about these things, if you have any ideas on that.
There are kind of two strands we could take in terms of action. There's like there's decarbonizing physiotherapy practice, or like making our practice more sustainable, but then also getting physiotherapy more involved in the planetary health and climate and social justice side, which I think we are really, really well poised to do, because our care involves such kind of cross systems, kind of holistic thinking. In Ireland, the HSE, our national healthcare provider, published something in September. It was called the Greener Models of Care Framework. And the idea for that was that it would encourage, it was just basically a kind of a framework for general medical care and how to make that more sustainable. And it covered certain things like surgery and just kind of use of plastics. But the idea was that it would give a basic skeleton for other disciplines to model against and to produce their own kind of greener models of care framework. And it was something that came up yesterday in our own Ireland Roundtable meeting to possibly, it would take a lot of work, but to kind of make our own version of that in physiotherapy, basically highlighting how physiotherapy is very sustainable, but also how to greenify our own practice. I don't know what people would think of that. I can share the document if you like.
Yeah, absolutely, please.
And yeah, Ola, am I on mute, or I think I'm all right?
No, yeah.
That HSE Greener Models of Healthcare is really interesting, because what the HSE did is they kind of identified 15 kind of areas to go down that road of initially. So, anesthetic gases, inhalers, respiratory. The thing that I think stood out for me in it was that it felt like the HACPs weren't mentioned in it, that we have such a huge role to play. And like one area that could have been included was perhaps falls prevention, which would substantially reduce kind of the footprint so it felt like, I think it's a really great framework because it's got the promotion, the prevention, the education, everything that we're kind of looking at here. But for me, it felt like there was a gap of HSCPs. So it's great if we were to use it to model other services, but I think we need to be at that table as well, where HSCPs, like so health and social care professionals or allied health professionals, we needed to be in that main document as well. And for me, that it felt like a gap for us, that we weren't actually really highlighted in that, because we just we have the opportunity to contribute so substantially. So I think it's an area that we really need to advocate more for. And that's why we're kind of saying that we really would love to hear what other people are doing in other countries and really try and start putting some of that information together and just like highlighting what physios can do. Because without even realizing that there are probably services or people that that are doing this, but not actually maybe connecting all the dots in terms of like that systematic thinking and that approach. And we've got just such power and potential. So, Miguel, if people do have kind of ideas and suggestions to send through, should they pop them through to you on your email, or how can we start trying to get some of this information? I don't want your email bombarded as well, but we'd love to hear some of these stories.
Yeah, I'm including my email address in the chat box where we are having some interaction. For example, Rita is asking regarding the lack of cover of expenses with physiotherapy in health insurances. So people prefer to accept operations instead of having physiotherapy treatment. Then some questions about if there is any group within World Physiotherapy that focuses on this, or Asia for this issue.
So I know just on that World Physiotherapy piece, there is, so within the UK, there's the ADAPT group, which is very much focused around like global health. So I think there is a little bit more of a drive to look at trying to get a speciality group around this at World Physiotherapy. And there's definitely discussions of trying to get, but, to form a speciality group of World Physio, we need a certain number of member organizations to have a clinical interest group or a special interest group or a network in that area. But there definitely seems to be a real drive and a focus to look at that. Most, I think, member organizations would have a little bit more information on that they could maybe share with their members. But we could maybe look and see if we can get that information out, Miguel, because I know like we've joined it's just a WhatsApp group at the moment in terms of people being able to contribute. Within Ireland, we're actually looking at establishing, it's really in its infancy stages, but we're looking at establishing a planetary health network within the ISCP. And then, those groups would have the opportunity to then belong to advocate for the creation of a speciality group of World Physiotherapy.
Yeah, so that would be a speciality group, which would be absolutely useful, I think. So I think that would be very reasonable to do that, and I very hope that there's some action and development in that area. There's also, of course, the Asian and Western Pacific region, I think it's called, of World Physiotherapy. But I'm not aware that they have a special subgroup dealing with sustainability aspects. So as far as I'm informed, I think actually that the Europe region is the only World Physiotherapy region who has this system of working groups who are actively engaged with topics outside of the specialty groups of World Physiotherapy. So if you're interested to that, I would recommend contacting the Asia Western Pacific region of World Physiotherapy directly and ask about any initiatives into these topics. And with regards to the surgery and surgery being paid and all these aspects, I think it's incredible, is it? I mean, how can that happen? But it is happening, and I think there are many different reasons and aspects to that. But what we can do about it is to really promote the benefits and the advantages of physiotherapeutic care in comparison with the other things. And there's a lot of research out there demonstrating that a lot of surgeries are unnecessary and that the outcomes are at least the same with conservative treatment or rehabilitation involving physiotherapy. Not with every aspect, of course. They're necessary surgeries. We all know that. But I think it's part of our job to really go out there and promote the benefits of physiotherapy also in this area.
Yes, hello everybody. Thank you very much for hosting this important webinar. I think it's very important that we're starting to discuss all these aspects and how physiotherapy can contribute to the Sustainable Development Goals. However, I would like to start by commenting that when we talk about sustainability, we shouldn't confine ourselves only to environmental sustainability. If this is the case, then we should be clear about that we're talking only about environmental sustainability in terms of how healthcare systems actually can contribute to relevant sustainable development goals with regards to climate change and climate adaptation. Relevant to the concept of sustainability is also the concept of financial sustainability, how we ensure that our healthcare systems are financially viable in the future. We see, for example, demographic transition, epidemiologic transition. We see, for example, models of care that are changing, trying also to place a higher focus on prevention as a way to reduce healthcare costs. So I think that we should be clear about the work of this kind of working group or the agenda that we will put, that the focus will be on environmental sustainability and the contribution to the relevant SDGs. My second comment in relation to how physiotherapy contributes has to do with a kind of the line of actions that we should be focused on, or the central axis, I would say. So one, it was mentioned, and congratulations for taking this initiative to map actually the activities that are taking place in higher education with regards to the inclusion of sustainability, environmental sustainability in higher education. However, other axes that have to do with models of care or the where and how physiotherapy is practiced are also significant. You mentioned previously how we can examine the potential for synergies with other initiatives. One way would be to explore what the European Public Health Association is doing in this field with regards to urban health. So urban health is a big concept. And there are a lot of initiatives and research that examine how the place where therapy may take place or is being conducted, for example, whether it is adaptations in the city, whether it's group therapy or other places, can actually contribute to both environmental sustainability and better health outcomes. Also, nature-based solutions. Nature-based solutions are also a concept where the European Union is placing more emphasis nowadays. And if you look at the European Horizon work packages that have been announced for 2027, there will be a call for nature-based solutions and their contribution to improving health outcomes and health equity. And with this in mind, I'm just mentioning that there is research that tried to connect physiotherapy in natural environments for older people as a way also to combat loneliness. So these are examples and initiatives where you try to achieve multiple objectives, multiple goals with one solution. And this is called working smarter in healthcare. So you put physiotherapists to work in another environment with a specific work group trying to achieve multiple objectives. So it is important just to think a little bit broader, I would suggest, and perhaps have concrete lines of action, concrete lines of even of advocacy, as Fran mentioned before, because it is important, and to see how these lines of action we can achieve also horizontal synergies. So we don't only have a kind of, a vertical approach, but also there will be cross synergies across these lines, and to see what other partners we can involve in our agenda. I'm just thinking aloud that, for example, with regard to the comment that was made about health insurance, it is very difficult to convince regulators and health insurance providers to reimburse, for example, a green practice of physiotherapists if at the same time occupational therapists or physiatrists do not do that practice, for example, do not exercise that practice. It's very difficult. So, and perhaps we should start embracing the concept of rehabilitation, green rehabilitation, instead of only green physiotherapy, because it's more appealing to insurance regulators and insurance providers, and it will be easier for us to promote holistic concepts of recovery, because this is what matters to public health policy decision makers. It's not whether we raise our professional profile or we raise our position in the global health agenda, but whether we contribute to their own agenda and to how they can better achieve their own objectives. So holistic concepts of recovery embrace not only physiotherapy, but also other professions, and we should be also attentive to this.
Thank you so much, Dimitris. I think you've kind of touched on a good number of points there. I think what we need to just, kind of come back to is, so when the professional practice working group is looking at things, we will work on things that get recommended at a general meeting. So our work and what we're doing is very much comes from the recommendations from members and member organizations, and then we go from there. So this was kind of the starting point. So, this work started kind of 2022 and it's built 22, 24, 24 into 26. And initially the recommendations was very much around the sustainable development goals. And those kind of the main pieces of work that we've done was building on the recommendations that were approved at the general meeting. And we'll be coming up to a general meeting in 2026, and we can take all of these ideas and suggestions and we can kind of explore it further and go, actually, now we need to go broader, or now we need to think, okay, so we've done that. What's the next piece of work? And we can very much kind of go from there. You've touched on financial sustainability. There's a resource sustainability. We have a global healthcare shortage. I think we've got to start really looking at that. There's one thing saying, well, physios and healthcare practitioners, we can change the way delivering care and actually reduce our carbon footprint. But if there aren't enough of us, well, then what's going to, if there's, we just can't produce enough healthcare workers, and we have a global healthcare shortage. So I think there's the financial sustainability, the resource sustainability, the, SDGs and that sustainability. So there's so much work. And I think it's a really exciting piece, and it's great to have everyone here to kind of contribute. So I'm going to, before we take any more questions, I'm going to lead into talking about Congress for November, because I think this will give an opportunity for people to come in and kind of give us comments as to what you think, what you would like to actually have there. So the Europe region will host its Congress in Madrid on the 5th and 6th of November. I'm right with those dates, Miguel? Correct me if I'm wrong. But 5th and 6th of November of next year. We'll be having a 2-day Congress in person in Madrid, and we'd love to see as many people there as possible. And it's been decided that we will be having a networking event around sustainability. And, now we're kind of going, well, what is exactly defined within sustainability? And are we talking about climate? Are we talking about finance, resources? So we can very much look at that. The thinking at the moment is that we would have a thematic kind of roundtables where we would be looking at, sorry, I just popped a few notes here, so I just want to quickly go to that. We'd be having a networking, looking at how physios contribute to sustainable clinical practice and the broader sustainable development goals, and continue with the work of the professional practice working group. So our proposed format is that we would have thematic kind of roundtables, where each table would have an opportunity to discuss a specific topic or a theme, and really promoting how physiotherapists could advance on these goals. So some of the ideas were, having a thematic roundtable and looking at good health and well-being and how physios support preventative health. Something that came up earlier was inequalities. So having a roundtable and have a discussion around reduced inequalities and strategies to improve access for under-reserved populations, addressing cultural, geographic, financial barriers, and partnerships. And we could have a roundtable discussion around sustainable cities and communities, looking at urban health and the differences there, innovation and collaboration, looking at innovative projects and success factors. So that's kind of what we really, a bit of a rough idea. We don't have an abstract approved as yet, or we haven't submitted one, and we'll have a better idea kind of towards the middle of December. But I'd love to hear from the participants here. Would you be excited to attend something like that? We know, we don't want to go and talk about just single-use plastics. We've got to make this conversation so much bigger, so much broader. So I'd love to hear kind of what you guys think about that and any ideas you would have for it. Yeah, go ahead, Dimitris.
I think it's a very good and effective approach. I think it's a very well described structure, and it will serve us good. And the thematic roundtables, I'm just thinking aloud, what would be the purpose? Only to present, or also to gain feedback from the members who will attend? Like, we have to make them a little bit more valuable for us in terms of the final product, like what we want to achieve. So we want to, for example, achieve a high level of engagement. Like, will these thematic roundtables continue with engaging those members that will attend after the end of the Congress, so that we can have some kind of tangible products? May I describe one? For example, if there would be a thematic roundtable on physiotherapy and urban health, it would be good to have as a product, to have a scoping review on physiotherapy and urban health, which I know that there's no research that exists, or no publication exists right now. So, or we could bring together the people who have an interest in coordinating this roundtable to start working preliminary on some of these products, so that these can be presented in the Congress. So, for example, if we're 3, 4, 5 people that we will start coordinating the physiotherapy and urban health, then we start working on a scoping review, and we'll present the preliminary results or the final results in the Congress. The same would, for example, would happen for another thematic roundtable. So,
I think that's some lovely suggestions and ideas, and absolutely we can kind of explore that more. But I love the idea of, our thinking would be that, we would have kind of, some key questions which would be able to facilitate the discussion and get people talking, but it would definitely be an opportunity for people to present afterwards and kind of, present the work and what the discussion was. But I like the idea of maybe people coming kind of a little bit informed ahead of time. So it would kind of facilitate the discussion. So I think that's definitely something we can look at, and we can see. Maybe we just narrow it down and don't have as many. We could have maybe just 4 or 5 key topics, but really kind of almost give people the idea of these are the topics ahead of time. So there's an opportunity to come informed. And then it'll really drive the discussion, the opportunity of people being able to stay in contact afterwards, or actually being able to give idea in terms of, I don't want to say dictate the flow of work, but, you almost want it to be able to not just be at that event, that actually it continues and there's a continuation of something. So it would be fantastic to see. So I think we might just be giving the Secretariat a lot more work there in the thinking of all of this, but I'm sure that sounds really great. So thank you.
Yeah, I also think that it would be really good to have something that carries on after the Congress. And from our intention, from this subgroup of the European Region Working Group, it is definitely not to use that session just to present anything, because we can do that in different formats. We can write that up as well, and do whatever. But this is a networking session. It's about getting ideas and discussions going, and see what everybody thinks, and bring up new ideas or activities. And so our intention is clearly not to just present something there.
Or sorry, Stefan, for interrupting. Or we could have a priority setting exercise. For example, if all the thematic working groups come together, setting the future agenda for the next period, for 26, 28, for example, and we could have a prioritization exercise setting priorities for research, advocacy, and practice in green physiotherapy or in sustainable healthcare and physiotherapy. By kind of, televoting or voting in the room, we could, for example, work on that on having such an exercise and come up with a future research agenda or future agenda that incorporates the engagement and the views of our own members.
Also, if I can come in, I would like to take this opportunity that we are talking about the Congress, where there was a question saying that if it is possible to hold the meeting in a hybrid format. I think they are speaking about the Congress. This Congress will be in person in the beginning in Madrid. So for the moment, there is no option to attend online. And also, I would like to tell you about the actual call that is open. Now we have the call for Focus Symposia open. So also, if you have 2 or 3 colleagues where you are working in a specific topic, for example, in sustainable development, you can send your application and the call will be open until the 19th of December. You will find more information in the website of the Congress that I sent in the chat box. Thank you.
Yes, and maybe Dimitrios, I can come back to what you said before, which I think were very true words in a number of aspects, really. And that's sort of what we've been trying to talk about before, because we really think that, yeah, it's about rehabilitation. So it's not necessarily about physiotherapy, or not necessarily about physiotherapy as it is at the moment. So the Europe region is currently also working on a position statement on physiotherapy, on rehabilitation as a human right. And I think that we need to think more about the role in society and healthcare in society as physiotherapists. We have to be less protective of current physiotherapy practice, but rather discuss and see how we can actually transform it to better serve the needs of society and the individual patients. And that's sort of what we tried to demonstrate with this slide here, because we can talk about reducing waste in physiotherapy clinics, reducing carbon things, reducing number of surgeries, all these things. We can talk about those, and we have to talk about those, and we have to do that. But it won't be enough. It's not enough to talk about physiotherapy as it is at the moment. It's not enough to talk about how can I reduce waste while my patients still walk into my practice. For a number of reasons, because it's not enough from the environmental sustainability aspects. It won't be enough to do that, I'm sure. So obviously I don't know, but that's my impression if you look at the problems that we have on a global level, and also in terms of financial aspects, all the things you mentioned, personal health justice, inequalities, all these things, workforce shortage. So it's not enough to keep things as they are and try to improve them. We need to think out of the box. We need to make real transformations of our profession and see where we can contribute, how we can change to contribute better. And that's what we meant here with current business as unusual. So it's doing health interventions outside in the nature. It's the urban projects. Miguel, wasn't the You Can Act? Wasn't that an urban health project? Have you been involved in that? I'm not sure.
Yeah, well, the You Can Act project is it will finish next year in March. It's regarding physical activity to prevent cancer in open green spaces.
Yeah, exactly. So there are these kind of projects, and so we are really looking for people, and that's again my call. We are really looking for people who are already doing things like that, who are already working outside the box, outside the normal And I refer, obviously coming from the European context, I refer to normal as physiotherapy business might be normal in Europe, that might be different in other countries. But we are looking for people who are working outside that box, who we can sort of talk to, whose stories we can draw out and tell other people about it, who we can use as examples where we can say, look, this is what you actually could do as a physiotherapist. You're not limited to seeing patients one-on-one in your clinic. You can go out there, you can do this, there are different actions. And so this is something that we really, we think as a professional practice working group that we need to push that and to develop ideas and actions around these lines of thought as well.
I'm Christy. I'm talking from Albania. Albania right now is starting some development in sustainability and environmental awareness. And I think we are the first group, me and some colleagues, that we just joined the association right now. And we wanted to change the perception a bit on rural areas, because right now we are lacking services in these particular areas of physiotherapy services. So I've done a little study in one small rural area, and now we want to scale it in nationwide in order to kind of propose like a project in order to push physiotherapists to go and provide have their services more in rural Albania, because right now what we are seeing is that a lot of people travel to big cities in order to get physiotherapy services. And Albania is a small country, so the more we travel, the more the carbon emissions rises up. So do you have any frameworks regarding studying the needs, or what has been done before in order to kind of promote rural or physiotherapy, etc.?
I think specific to kind of what the working group has looked like, we haven't kind of explored that space. There may be some information out there. I know I might be putting Ola on the spot here, but she might have some information for us on that. Ola's with the Irish Doctors for the Environment, so she might be able to give us some information or guide us a little bit there.
I think there was a few studies over COVID regarding telehealth, so kind of doing physiotherapy via like online. And I know in Ireland a lot of insurers have moved towards that. In rural Ireland, I'm not based too rurally myself, and I'm not in the community. But yeah, there is a lot of travel. Now, I do know that there's a psychiatry service that have advocated for bicycles. They managed to get a grant to get electric bikes, so that they can cycle to their patients rather than drive, and that reduces their carbon footprint. And so the physio, or the psychiatrist in this case, would travel to the houses or the centres rather than people coming to a centre. But that is based in an urban area, but there's no reason why something similar couldn't be looked at in a rural area as well. You're based in Albania, is that right?
Yes, right.
Yeah. I'm not sure if I can find any more. I absolutely, I'll send it on. So I'm sorry, I don't know much more than that.
So if you,
I just kind of put you right on the spot there, Ola. I just thought maybe you would have some ideas.
It's all good.
But Christy, if you look at the website of World Physiotherapy and just use the search function to search for physiotherapy in rural areas, so I know this is an issue not only in Albania, obviously, but it's almost worldwide, I'd say. So we have that same problem in Germany. I'm based in Germany, and this is same problem, maybe on a different level. But as compared to the average healthcare, there's an issue here. And I know they have the situation in Australia. They have it in many countries in Africa. So it really is a global development
issue.
Yeah. And so if you use that, I'm sure there is some information. It might not be exactly what you're looking for, but there might be some hints and some tips. So I know that the Australian colleagues have developed actually a special pathway for general physiotherapy practitioners in rural areas, for example. There have been experiments with satellite clinics in rural areas, and so So if you use that search function on World Physiotherapy, there might be some interesting information for you.
Okay, great. Thank you.
Are there any more questions or comments or additions, ideas?
I guess my big question is what can we do now as a group between now and the Congress? Is there any kind of actions that we can take between now and next year, kind of as a group or even individually, in terms of, say, paper? Like, I was going to suggest the writing of like a position paper on the role of physiotherapy in I know that would be a big undertaking, but the role of physiotherapy within sustainability and all aspects of sustainability. I don't know what people think of that.
I would say that there are a lot of things that we could do, but the problem is that we, for example, for a position statement, of course, it would be a political statement, and we can always work on preparing a text that would be an advocacy text to advocate for the role of physiotherapy. But the truth is that we have not done yet enough to be able to convince really about our role and how our role could be more meaningful in terms of, actively contributing to advancing the Sustainable Development Goals and to achieving all these climate-related objectives or other objectives that are described in the. So perhaps we could start by creating or putting the pieces of the puzzle together, like working on a broader agenda, putting the things that we know that matter to policy decision makers and of course for healthcare systems, and start working on small working groups on these little pieces. It can be, for example, a qualitative study of how, for example, other people outside the field of physiotherapy perceive our role in contributing to climate-related objectives. A small interview study. It could be a scoping review on physiotherapy in urban health. It could be, so having 2-3 papers, published within the next year or the next 18 months would be something, of course, to keep us united, to keep us having a comprehensive agenda and a coherent agenda. And of course, it will lead us to more synergies with other organizations. So I would suggest that it would be premature. I mean, of course, we can work on something, we can always develop something, but this something, I think it should be not overly ambitious in terms of, over advocating about our role, but we should be more realistic. We should be more realistic and based on evidence. So, and
I think sorry, I'm busy. I apologies. I couldn't get myself off mute just now, so I wanted to come in and add something, but I just couldn't come in on the conversation. Dimitri, I hear what you're saying there in terms of being over ambitious, but I think if we're not ambitious, I almost feel like we need to be. And I think I don't know. I mean, I'd be interested to hear what other people think, but I think there is perhaps opportunity for the Europe region to write a position statement. Like we do have position statements on physiotherapy in primary care, which is a big piece. So I think there is perhaps an opportunity to explore that a little bit more. But maybe that's just maybe I'm just over ambitious in certain areas, but I quite like the idea of maybe exploring that a little bit further. But I hear exactly what you're saying as well.
Of course, I'll give an example. For example, Christy mentioned before about the need to reach populations that are in rural areas. And this is a perfect example of how physiotherapy can turn green and viable and sustainable, because you achieve both the objectives of environmental sustainability with telephysiotherapy and telerehabilitation, which is more financial, also viable. And of course, you can achieve also other objectives in terms of, patients' convenience and etc. So we can put examples, and we have examples from the literature that physiotherapy can contribute. But I'm just afraid that we will just stay on the surface if we have not yet, examined the issue more in detail. So Usually policy briefs or evidence briefs, as they're described, are briefs where you summarize an already established body of evidence. And that is why kind of, I'm just thinking aloud and I'm just, discussing openly this, that a policy brief or a policy statement would summarize the established body of evidence on our role in contributing to climate change. Then we have it, if there is such a body of evidence.
Yeah, I agree, Demetrius, in we do need to produce more evidence that support our role within sustainability. I guess I think the two could live at the same time, that nobody has ever spelled out our role in sustainability before, like in a really like in that little list I put in the chat there. Nobody's really like published a paper just spelling all that out, and I don't see the reason why not. Like we can't, because we do have evidence in terms of healthcare emissions. We've evidence in terms of financial savings. Like for example, in Ireland, active travel saved Dublin City alone over 64 million euro in 2023 or 24. Like it's those kind of stats we do have, and we can build on and be like, well, we know physiotherapy is a holistic role. Let's spell it out for the international healthcare community, like that we want to step up. Because people don't know, they're not putting two and two together. I was at a national conference for our national healthcare provider, and there were all these doctors talking about lifestyle medicine, and I was like, we have been prescribing this for years. Like, why aren't we up here? Why aren't physios up here? But so I think we could like just get the ball rolling on a paper. But at the same time, look to produce the same evidence that you're looking for as well, because that would support us even further.
Exactly. Yeah, this was my point. You have described it exactly. Just to be more diplomatic, for example, it would be kind of titled like Physiotherapy and Sustainable Healthcare Options for Action, which means that we can delineate some options. However, it's a thing that is still in progress, and the evidence is still generating, and we will be able in the future to be more convincing to policy decision makers about our role and how this role can be fortified.
Thank you all for coming, and it sounds as if there has been a great discussion. And yeah, I think what Fran has said and Stefan sounds like a good idea. So the one thing we have to keep in mind is obviously to keep in contact with the Environmental Physiotherapy Association and kind of let them know how today went, because it's really remembering that it's under their auspices that we're doing that. And the question is, working together with them. I've always worked with Philip Marek, who leads on the association. So I suppose it's that kind of combination as well. It's really, as you know, today was a real global event, yesterday and today, to see where as physios we're working in the environment. So I think just a little bit that I've heard sounds great, but I said to kind of work closely with Philip as well. And I'm sure the working group have said, but they also have worked with Philip in terms of the work that we've been doing. So
thank you very much for attending this meeting. I think it's been a good discussion. I think it's been very valuable to have this exchange, and thanks a lot to the EPA for taking this initiative and making this available and integrating us into providing this opportunity for us to contribute in this way. And I hope very much that we, in one way or another, stay in touch. We see you at Congress at least, and maybe in between get some information exchange as well. Remember that we are open, and as from my experience, the EPA is always open for approaching them and contacting them, talking to them, exchanging ideas. And it was very good to have you here. Thank you for your input.